Here is your question. Right, so if you have read and understood considering a surgical anatomy station, kindly please tell me what are you looking at?
Looking to the cubital fossa.
Okay, maybe which side?
Maybe, sorry.
Which side, if you can identify?
Which side? It's the right.
Right, okay.
Right arm.
Can you please tell me the boundaries of the cubital fossa?
Okay, it's brachioradialis. This is the lateral side, and for
Superolaterally, yes.
superior laterally, yes, and imaginary line in two epicondyle of humerus. This is superior, and from medial, medial, posterior medially, it will be pronator teres.
Yes, and floor?
The floor, it will be
Brachialis.
okay.
And okay, can you tell me the contents of the cubital fossa, medial to lateral? So this is medial and this is lateral. So if you can tell me from medial to lateral, this will identify, yes.
Ulnar nerve, radial, brachial artery.
What is, this is brachial artery. So what is A?
This is medial nerve.
Median nerve, yes. And then what is this?
This is a tendon of biceps muscle.
Yes, biceps tendon. Okay, if you can identify, what is this? C?
This is profunda brachii.
Okay, can you identify number H?
Number H, it will be the ulnar artery.
Are you sure? H is starting, this is what?
This is brachial artery.
Yes. So if this is ulnar artery, all right, okay. This is lateral side, yes, can be. So if you can identify number G, please.
No, sorry, it's radial artery. I mix the two sides. This is radial
That's
artery.
why I told you this is lateral side. So you have to think. Okay, if you can identify number G, please.
Pronator, pronator teres, yes. Pronator teres muscle.
Okay, if you can tell me how the cephalic vein is formed. Can you identify cephalic vein here?
Cephalic vein.
It's in the image. If you can.
It's already in image.
Yes, it is.
Okay, one moment.
What is D?
D, yes, it's cephalic vein, yes.
How is it formed, please?
Okay, it starts from palmar dorsal arch of vein in the hand, and with basal, there are two branches from there. The medial one, it will be basilar vein, and the lateral one, it will be cephalic vein, and they are run towards proximity, and they have a connection medial vein in the cubital fossa. After this,
median cubital vein, yes.
Yes, middle cubital vein, and they are after this the basilar artery. They are only one vein, and they run in the arm, and then it will be axillary, and they are
Axillary vein. Okay.
drain in
Can
the
you
subclavian.
please tell me how many groups of muscles there are in the forearm?
There are two, extensor and flexor, and flexor
Flexor
in
muscles, okay. Can you name the flexor muscles of the forearm?
yes. Sorry, there are flexor carpi radialis, carpi ulnaris, longus and brevis, and there are flexor digitorum profundus, flexor digitorum superficialis, pronator teres, pronator. There are supinator and palmaris longus. Sometimes it exists, and there are extensor. It will be extensor carpi radialis and ulnaris, longus and brevis.
Okay.
And
Can you please tell me if you can identify profundus?
C.
Okay.
No, the muscle
No,
or
muscle. Muscle. C is
okay. The profunda brachii artery.
Yes.
Flexor profundus. It will be
where would that be located? Okay, we'll come back to that later. Can you please tell me if a patient, if a person comes to you with an injury on the elbow joint, and you suspect injury or severeness of the radial nerve, how would the patient present? Or what would be the complaints of the patient, which
will
we
be
can confirm? Yes.
okay. It will be the wrist drop and finger drop. Okay, and no sensation over the 3.5 finger in the dorsal, and 2/3 of the dorsal hand lost of sensation, and it depends on the level. If it sometimes different above from level to level.
Can you identify or can you tell me how the flexor retinaculum is formed and the attachments of the flexor retinaculum? If you can get the image A, and yes, please.
Yes, the flexor retinaculum, it's formed from scaphoid. This is laterally and proximally.
Yes.
And hamate from distal laterally, and from medial it will be trapezium. This is distally medial, and
yes,
bisiform proximal medial too.
Yes.
This is the flexor retinaculum.
Yeah. What are the structures which pass below the flexor retinaculum?
Okay, there are median nerve and flexor digitorum profundus, flexor carpi radialis, carpi radialis, yes, and flexor and the senar muscles, radial artery.
Okay. Right. Can you also tell me what are the if a patient suffers from carpal tunnel syndrome, how would he or she present to you? What would be the features or the complaints?
The complaints will be dropping many things, and he has pain on the palm of the hand.
Yes.
He can keep holding things, and he keep falling things.
Yes. Okay. Right. How would you test? All right, that I'll ask in the next station. Right. How would you confirm the diagnosis of carpal tunnel syndrome?
I will do tunnel test or Fallon test.
Yes.
If the patient has feeling numbness over the palm of the hand, he has positive sign for carpal tunnel syndrome.
Okay.
I will try to make some investigation, maybe nerve electrogram
Yes.
to confirm my diagnosis.
Okay.
And yeah.
Thank you.